Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and all I perform is aesthetic or cosmetic surgery. One of my favorite procedures is a rhinoplasty, and I see a lot of patients for that procedure. A common question is, what are my options for having a rhinoplasty or nasal surgery if I have very thin skin? And the answer to the question is many. A rhinoplasty is cosmetic alteration of the nose, and a lot depends upon presentation. When people come in, one of the first things I do is take a look at the nose. We examine you and talk about options for you. Most commonly, people present with dissatisfaction, maybe a nasal bump, maybe they feel that their tip does not match the rest of the nose. And really, those modifications are very delicate and very precise that I perform with a rhinoplasty. In patients that have thin skin, I think it's very important to understand that the most common decision that you'll make with regards to having a rhinoplasty is who performs the rhinoplasty. And I think you want to find somebody that performs a lot of rhinoplasties and has a very low revision rate, of which I do. Nasal skin is a very important component with regards to the outcome from a rhinoplasty. The reason being is that if you have thin nasal skin, any irregularity after a rhinoplasty, any little specific residual cartilage or any nasal bone that was not taken down will show through the skin. So although it's not anything to be afraid of about having thin nasal skin, I think it's very important to talk to your surgeon about that and how we can modify any approach. In people that have thin nasal skin, I like to talk about the fact that sometimes I will take some tissue from the scalp and line it over the cartilage and bone in order to provide some kind of cover so it looks smoother. Nasal skin, the good thing about having thin nasal skin is that you will see the result much more rapidly than people that have thicker nasal skin, and I think that makes patients much, much happier. In patients that have thin nasal skin, if there's very little that needs to be done, sometimes a soft tissue filler can be placed for modification aesthetically of things that can bother patients. So that may be some kind of soft tissue alteration that could be performed without a full rhinoplasty. So sometimes we will actually put soft tissue filler in lieu of or instead of a full rhinoplasty. Other than that, I think that having thin nasal skin is not really that much of a handicap, and I think it's a very important thing to discuss with your surgeon about what options are available for you, and to make sure you go online, take a look at before and afters, take a look at patient reviews, and come in with pictures of noses that you like. But overall, having thin nasal skin should not be anything that should deter you from having a rhinoplasty. Thank you very much.